I was a patient of Dr. Cannon's, starting in my high school years, went into college years. At the time, there was numerous things that happened. At the time, it didn't register to me how awful it was. And then in January, I saw it come out that there was, other women that things happened to, and just made me completely violated. I just feel really bad for my previous self, and that I didn't register how awful it was. And there's just been a lot of different scenarios that he put me into that are very wrong. So coming forward is just helpful to me, to these women behind me, and then anybody that this is happening to. At the time, obviously, I was a lot younger, and I was, I have tattoos on my body that can be seen in a setting, in the doctor setting, in that kind of practice. And it started with that, commenting on tattoos that I have, which then fast forward to now, he is now undressed, showing me his tattoos in this position, and then just trying to meet up with me outside of office hours, different things like that. So at the time, it didn't register how wrong it was. Now I realize I'm an adult now, and it's brought up so many feelings now that I now have to go through and face them and address them. There was numerous, I'd say, instances I was violated, but there was like 4 big events that as soon as I saw that press conference in January, I immediately flashed back to me at that age, in that position, in that office, and made me come forward now.
He delivered my son, who's 8, and my 3-year-old. I just want to say, being African American and meeting him to deliver my kids, I felt betrayed. I felt, seeing the news, a little uncomfortable. I had questions and worries because I was high risk with my pregnancies, so I just was unsure if he gave me the best care I can receive, hearing all the things that were being discovered on the news. So I speak with the list, and he did have like a little slur, but I assumed that he spoke that way as well. My mom would be present, or my kid's father, and when we did question that, we kind of assumed, like when my mom asked about it, I thought like maybe he speaks with the list like me, or I don't think he would be drunk working in the middle of Wheaton, a black doctor in Wheaton being drunk. I doubt it. So I gave him the benefit of the doubt, thinking no way a doctor would be working in Wheaton under those kind of situations. And seeing the news in January, I just felt betrayed. I felt worried. And then hearing that more women had way serious things going on than me, kind of just, I felt that I needed to come forward and speak up, because it could have been me. It could have been my daughter if I bring her someday.
Seeing the other ladies come forward in January is what kind of confirmed the red flags and the odd things that happened during the delivery of my daughter, and just seeing that on the news was really hard.
What happened during the delivery?
So in June of 2020, I was at Central DuPage Hospital. I was delivering my daughter, and Dr. Cannon was the doctor on call, so he wasn't the normal doctor that I had seen for my appointments with that pregnancy. It just happened that he was on call that night, and I was ready to deliver, and they had to call Dr. Cannon multiple times to come to the room. And when he finally got to the room, his eyelids were really droopy, and he was moving slow, and even though I was 100% ready to deliver my baby, he was standing at the back of the room, like looking in the supply cabinet, and just kind of standing there out of it, not really reaching for anything, just kind of waiting there. And I actually made a comment to my husband about kind of what's up with the doctor, and he was just overall very slow, and the nurses were actually coaching me to not deliver the baby while we were waiting for Dr. Cannon to get all of his gear on so that he could help. I mentioned that I had made a quick comment to my husband about kind of what was up with the doctor, and being that it was my fourth child, I was pretty comfortable in that situation, and so I think that the biggest thing in the front of my mind was focusing on what my job was as a mom. But just having that back of my mind thought of, I know the nurses are taking care of me, and I just really felt like I was at a great hospital and that I was going to receive great care. And so looking back and remembering the red flags and then seeing the media coverage in January confirm some of the thoughts that I was having, it was really disturbing for me.
I was a former co-worker, worked indirectly with him as he was acquisitioned at the time, their service with Dooley. I would onboard all the new providers. So I had indirect but direct, because I was also a patient of his, contact with him. And learning about this in January just brings tears to my eyes, as I currently still work in the medical profession, and for women to take the trust to even go these days, to go for their health cares, to go for their mammograms, I feel betrayed. I do have trust issues now. I pulled all my cases out from Dooley and I switched to a completely different medical organization. When I go and see new doctors, I question. I question myself. I have the fear, the anxiety, and the situation that happened was unprofessional, what he did. I did not have a chaperone with me in the room, and I do have tattoos on my lower abdomen, and that's how our conversation went. And what medical personnel would be taking off their shirt and showing their patients all their tattoos, where he would unbutton his shirt, took off his lab jacket, and proceeded to show me that he was fully tatted.